Hello all, I'm Fadila Shaib speaking to you from WHO headquarters in Geneva and welcoming you to our press conference on global health issues with a special focus today on the humanitarian situation in Gaza. By now, you may have received our report about estimating trauma rehabilitation needs in Gaza with a news release. To speak about these issues, let me introduce colleagues who are here in the room, and we have several online. Starting with Dr. Tedros Adhanom Ghebreyesus, WHO Director General. We have with us also Dr. Maria von Kerkhoff, Interim Director, Department of Epidemic and Pandemic Management. Dr. Janet Diaz, Head of Safe and Scalable Care Unit and just back from DRC. And we have Dr. Chikwe Ihekwezo, who is the Executive Director, Health Emergencies Program. And we have also with us Dr. Jeremy Farrar, Assistant Director General for Health Promotion, Disease Prevention and Care. And the last person in the room is Dr. Teresa Zakaria, Team Lead for Humanitarian and Disaster Action. We have also online Dr. Rick Peeperkorn, WHO representative for the occupied Palestinian territory from Gaza, and we have also Pete Skeleton, who is the main author of the report that we will be talking today about, and he's joining us from Beirut. Now, without delay, I would like to hand over to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you, Fadila. Good morning, good afternoon, and good evening. It's now been 1 month since the government of the Democratic Republic of the Congo declared an outbreak of Ebola virus disease near the town of Bulape in the center of the country. So far, 64 confirmed and probable cases, including 42 deaths, have been reported. 9 people have recovered and been discharged, and 13 others are currently being treated. We have now had 5 days without any new reported cases, which is good news, but more than 1,800 contacts are still being monitored. The area in which the outbreak is occurring is very remote, which is helping to contain it, but also makes the response very difficult logistically. For example, WHO has had to build 2.5 kilometers of pipes in order to supply the area with water. We have also equipped the Ebola treatment centers with oxygen concentrators, which can be a life-saving treatment for the most sick. Prior to this outbreak, health centers in the area had no access to concentrated oxygen. This week, WHO published our Strategic Preparedness and Response Plan with an appeal for $66.6 million to support WHO and our coalition of partners in implementing the National Response Plan. Once again, I congratulate the government for its response to this outbreak and its leadership. As you know, next Tuesday, the 7th of October, marks 2 years since the horrific attacks on Israel by Hamas and other armed groups, in which 1,200 people were killed and 251 people were taken hostage into Gaza. Those attacks led to 2 years of conflict in Gaza, in which more than 66,000 people have been killed, 70% of them women and children. Thousands more are missing, presumed dead. WHO welcomes the peace plan for Gaza proposed by President Trump and supported by other countries in the region and beyond. We welcome the proposal for an immediate end to the conflict, for the release of all hostages, for the resumption of humanitarian aid, for the reconstruction of Gaza, including its hospitals, and for peaceful and prosperous coexistence for Palestinians and Israelis. 2 years of conflict have devastated the health system and inflicted relentless suffering on Palestinians. Currently, only 14 of Gaza's 36 hospitals are functioning, even partially. Health and humanitarian workers, including WHO staff, have been on the ground throughout the conflict under extreme and unsafe conditions with minimal supplies, food, transport, and fuel. Some have paid the ultimate price. According to Gaza's Ministry of Health, almost 1,800 health workers have been killed and at least 543 aid workers. WHO's work has been built on three main pillars. First, delivering essential health services. WHO is the main provider of medicines and medical supplies in Gaza. Over the past 2 years, we have provided supplies that have supported more than 22 million treatments and surgeries. We have coordinated more than 50 emergency medical teams, made up of medical experts from around the world who have operated field hospitals, clinics, and delivered essential services across the full spectrum of health needs. We have provided almost 17 million liters of fuel to health facilities and ambulances, and we have supported the treatment of more than 500 severely malnourished children. The second pillar of our response has been on public health intelligence, early warning, and prevention and control of communicable diseases. Together with our partners, we led a vaccination campaign that protected 600,000 children from polio. We're working with over 700 health facilities in Gaza and the West Bank to track the availability of health services and resources, and we're working with almost 100 health facilities to monitor and respond to disease outbreaks. The third pillar of our response is health emergency coordination. Over the past 2 years, we have coordinated 88 partners in Gaza and 35 in the West Bank through various technical working groups. Together, we have provided 31 million consultations and care for 1.6 million trauma cases and 2.6 million mental health-related cases. The destruction of civilian infrastructure in Gaza is immense and will take a long time to rebuild. The damage to people, physically and mentally, is even worse. New data from WHO illustrate the extent of the harm that has been done to the people of Gaza and their health system. In addition to the 66,000 people killed, almost 170,000 people have been injured in Gaza. WHO estimates that at least 1/4 of those have potentially life-changing injuries that require immediate and ongoing rehabilitation. The most common injuries requiring rehabilitation are blast injuries to legs and arms. Other major injuries include amputations, burns, spinal cord injuries, and traumatic brain injuries. Severe facial and eye injuries are also common, resulting in significant impairment and disfigurement. Of course, rehabilitation services are also essential for people with non-communicable diseases and disability. But just when they are needed most, attacks, insecurity, and displacement have put them out of reach. The explosions that cause these injuries also destroy the health facilities and services needed to deal with them. Over the past 2 years, WHO has verified 1,719 attacks on health in Gaza and the West Bank, resulting in more than 1,000 deaths and 1,800 injuries. And to that, famine in some parts of Gaza, unsanitary living conditions, disease outbreaks, and severe ongoing stress. Many of these with severe injuries and non-communicable diseases need specialized medical care that's not available in Gaza. Since the conflict began almost 2 years ago, WHO has supported the evacuation of 7,841 patients for medical treatment outside Gaza. Since the Rafah crossing was closed in May last year, WHO assumed responsibility for coordinating all medical evacuations. Most evacuations are for trauma, cancer care, heart disease, eye care, and congenital anomalies. Egypt, the UAE, Qatar, Turkey, Jordan, and European Union countries have been the largest recipients of medical evacuees, and I thank all those countries for opening their arms to these patients. However, about 15,600 patients are still awaiting medical evacuation, including 3,800 children. And at the moment, we're only able to conduct evacuations once a week. I call on more countries to open their arms to these patients. I call for medical evacuation to be restored to the West Bank, including East Jerusalem. And I call for the frequency of evacuations to increase. WHO was in Gaza before this conflict began. We have been there throughout, and we will continue to be there as long as this conflict lasts, and when it ends, as all conflicts do. We will be there to help rebuild Gaza's health system and its people. But as I always say, the best medicine is peace. 2 years of conflict have brought nothing but death, destruction, and disease and despair. The most courageous choose peace. So I call on all parties to this conflict to choose peace now. Finally, today is Yom Kippur, the holiest day of the year for Jews. I wish all those who observe it, Gamar Khatimah Tovah. May this Yom Kippur bring peace, forgiveness, and renewal. Fadila, back to you.
Thank you, Dr. Tedros. Now I will open the floor to journalist question. Please raise your hand using the raise your hand icon and unmute yourself. I will start with Carmen Pone from Politico for the first question. Carmen, please go ahead.
Thank you so much, Fadila, for giving me the floor. There have been a few reports over the past week that the WHO staff had a no-confidence vote against Dr. Tedros' restructuring plan, and I was wondering if he wanted to say anything about that, and is there any plan to respond to that in any way? Thank you.
Thank you, Carmen. Maybe Dr. Tedros?
Patrick should be online. Patrick?
No, he wasn't able to attend. Carmen, I will ask this question to our colleagues and come back to you in a written form. Is this okay with you?
Yes, thank you.
Thank you.
Yeah, maybe I can say a few words because the question is very important. As you know, we have started the restructuring some months ago now. Of course, part of this restructuring is, separating our colleagues, which is very, very painful. The reason I say that is the WHO staff have been working under extreme pressure, especially during COVID pandemic. And this is not what they deserve. But of course, due to the funding cuts that all UN agencies and other institutions are exposed to, we had to restructure. We had no choice. So from the start, what we have done is we outlined 3 principles. One is transparency, and second is fairness, and the third is humanity. So we have used this during our prioritization. And not only that, we have also made sure that the prioritization is focused on the core mandate of the organization. So all the selections for positions have been done based on functions, not focused on people who occupy them. So as far as I can tell you, by and large, the process was good. But of course, like any process, there may be some faults. And that's why we have the Transparency and Fairness Committee. And the Transparency and Fairness Committee looks at applications from staff who have applied or alleged maybe lack of fairness. But by and large, the process has been very good. And the ARC reports in the ARC committee, in all the ARC committees, staff association have been members, and they have signed all the ARC reports. And issues they have asked or they have raised during the committee meetings have been addressed. Many of those that could be addressed. But in the ARC reports, maybe a few issues have been raised, insignificant compared to the number of prioritizations and so on, from hundreds, for instance, a few cases. And a good number of those have also been addressed. And if there are pending issues, they will continue to be addressed. We have a robust mechanism and process. So if any staff has issues, they can use those processes, and any issues that has to be addressed are being addressed and will be addressed. But with regard to the General Assembly meeting that you have cited, this is a headquarters staff association only. And this restructuring is being done throughout the organization, in the headquarters, all regions, and also country offices. And an assembly where slightly higher than 100 staff have voted compared to 10,000 staff, I don't think represents the real feeling of our staff. So I think from the information in your reporting that I have seen, I think it's very important to include the figures and show, what the figures mean. Reporting it in general, saying staff have said this, I don't think will represent the reality. Because as far as I know, it's slightly more than 100 people compared to the 10,000 staff we have that have voted and expressed their concerns. Of course, we have encouraged our staff to use all means to ask for their rights, and we still adhere to that because since we said we believe in transparency, fairness, and humanity, any activity, whether it's by one person, 100, or whatever number, is acceptable as long as this is desired by our staff. So it would be good if you can, in your next reporting, probably include the numbers and not generalize as WHO staff, because the numbers will tell you a different story. But I would like to assure you again that we take this seriously, and we will do everything to protect the rights of our staff. We don't need any reminder to make sure that our processes are transparent, our processes are fair, and also a humane approach is followed, because we do it because we respect our staff, and we understand through what situation they're going through. But we have to understand also that the organization should emerge from this process stronger, so that we can help the people or continue to support the people we serve. And we're trying to use the current crisis as opportunity. And I believe that WHO is emerging stronger, sharper, focused on its core mandate, and more independent. And the reform we have started some years ago is helping us minimize the impact of this crisis. As you may know, in 2017 and 2018, we have identified reliance on few traditional donors as a major risk. Not one of the major risks, but the major risk, because it affects the organization in many ways. And at that time, we proposed broadening the donor base. And the reason we did that is we anticipated the same shock could happen 7 years ago. So we saw it coming. And with broader donor base, we can absorb shocks like this. But not only that, with broader donor base that's not dependent on few traditional donors, we can ensure WHO is more independent. And as you also may know, our member states have agreed with the proposal on financing reform and increased their assessed contribution by more than 50%. They have agreed to increase the assessed contribution by 50%. This is historic because in the more than 70 years of its existence, the organization, the largest increase has been 3%. 3%. 50% is very significant and very historic. And the contribution which is coming from that decision to increase the assessed contribution by 50% has helped us to minimize the impact of the crisis. For instance, the number we're separating from our organization are reduced by half because of the funding we got through the assessed contribution. The crisis would have been more impactful if we didn't have the finance reform. And this comes from our respect to our staff, knowing full well, even 7 years ago, how the financing model was impacting the morale of our staff. So the measures we have started long ago has really helped in minimizing the impact. And the number separating is actually less than half that would have been separated without the reform that we have started. So I can assure you that by and large, our process is successful. But of course, there will be complaints, and we're addressing them one by one. But that's a small proportion of, all the number of prioritizations that has been done, and that's being addressed. So thank you for that question. A bit unexpected, but I think it's very important, and it has to be addressed. And thank you.
Thank you, Dr. Tedros. Now I would like to give the floor to Iman Khariji from Kuna News Agency. Iman, you have the floor.
Thank you so much. I'm sorry for this obvious question, but I should ask it. Dr. Tedros, you said that over the past few years, WHO has verified 1,719 attacks on health system in Gaza and the West Bank. Could you clearly say who is responsible for these strikes or these attacks? And the second question, if you have any comment on Israel preventing the Freedom Flotilla, that was carrying baby formula and medicine to Gaza from entering Gaza. Could you comment on that, please?
Thank you, Iman. We have Dr. Rick Peppercorn from Gaza, and he will take the question. Rick, you have the floor.
I would like definitely to add some other things on Gaza, but I think on the attacks of healthcare, so WHO, it's mandated to assess, to analyze, and to report on attacks on healthcare. That's what we do. But we are not attributing. The attacks on healthcare. So I don't want to go into those details. Again, we are not an That's actually not a crime investigating bureau or organization, but we are trying to report as factual as possible. That's why we are checking 3, 4, 5 times on attacks on healthcare, and we analyze and we monitor. And of course, there has been way too many attacks on healthcare. So the criteria is also on the so-called SSA platform, and we can share it with you later on. If you allow me, I want to, maybe not now, if it's possible, I want to say, just come back from Nasser Medical Complex, and I want to maybe add 1 or 2 other comments on Gaza. Is that possible?
Yes, please go ahead.
Okay, first of all, I understand that the DG have been very much alluding to the updated reports of WHO on injuries. So I'll not go into details, just to mention that every time I come back, I was here again 6 weeks ago. Every 6 weeks, I'm here for a couple of weeks. The issue is changing, and fortunately, everyone who's been on the ground so regularly, we are absolutely not surprised with the analysis. We are part of that. That if you think about it, more than one quarter of 166,000 injured people needing lifelong assisted technology and care. It's shocking, and we see it all over. Just coming back from Nasser Medical Complex, the largest hospital currently in operations in Gaza, Khan Yunis, is completely flooded. We've seen, of course, a massive exodus from the north. It's estimated that there's still between 200,000 to 300,000 people in the north. So that means that roughly 800,000 people have gone south. Hospitals, Nasser was already flooded. Now again, it's everywhere, in every corridor. You see patients, and indeed, having witnessed over the last 2 years, so many of these patients, children with, if it's amputations or other patients with spinal cord injuries, the most horrific burns, crush injuries, etc. We need to think completely different about rehabilitation, and I want to stress that. So we are trying to already support that now, but this will be a major component whenever there will be a proper ceasefire and peace, etc., to be working on. I want to say something about health functionalities and specifically of the north, the hospitals in the north. So currently, so within Nasser Medical Complex, I also met a number of staff from Shifa Medical Complex and senior staff and other staff. So Shifa Medical Complex, the largest hospital, used to be the largest hospital in Gaza, 600 to 700 patients. And even until very recently, we reported on this 6, 7 weeks ago, bed capacity was at 300%, 600 to 700, 800 patients. Currently, you talk about 40 inpatients. More than we were told by their colleagues, the health work senior staff, that they estimate more than 90% of the staff have left Shifa. It's very difficult to access for the people. There is the only two functioning. It's functioning. The dialysis unit is still functioning, and for the rest, it's a bit of a trauma. But it's more like a trauma stabilization point. I cannot even say more about that. Then, so we have in the north currently, I think it's even less than 8, 6 to 7 hospitals which are partly minimal functional in Gaza City, serving an incredibly vulnerable population, people who have problems leaving for all kinds of reasons. They don't have the funds, they don't have nowhere to go, etc. We have seen 44 health service points which went out of services between 11 and the 28th of September, included like the Rantisi Pediatric Hospital, completely non-functional, the St. John Eye Hospital, non-functional, the Ministry of Health Ophthalmic Hospital, non-functional, Hamad Rehabilitation Center, non-functional, and what I said, Al-Ahli Hospital, minimal functional, and Shifa, we cannot even call it minimum functional. We will try to, and I'm afraid we were already asked to very quickly, WHO, we've done this before. We will be asked to actually medevac the remaining patients in a number of hospitals, and when feasible, take out some of the supplies. There was a WHO and UNICEF mission to run TC to take out incubators, etc., which was unfortunately refused. It never arrived. We also will be asked to medevac patients already as soon as tomorrow, and we will report on that as well. Declining shortages, I mean, like in medical supplies all over, but currently we are also planning for another missions to the north to bring some of the supplies, but we have to be very clear what we are bringing, because there's actually so few health workers left what they can do. So you talk about mainly some trauma supplies, some gauzes, some antibiotics, etc. What is currently in the south and everywhere a huge shortage is on blood supplies, including the blood components, anything related to blood transfusions. We have procured it as WHO, but we currently struggle to get it into Gaza. So that's another thing to be raised. I want to leave it there. Thank you.
Thank you so much, Dr. Pieperkorn. Now, I would like to invite Nina Larsson from Agence France-Presse to ask the next question. Nina, you have the floor.
Yes, hi. Thank you for taking my question. I wanted to also ask about the number of life-changing injuries that you've mentioned. There seems to be a very big increase, and I was wondering if you could say whether this is because there's been an escalation in the numbers of people being injured, or if it has to do with back counting maybe. I was also wondering if you have an estimate of the number of children amputees. I'm sorry, I haven't had a chance to read the report itself. So if you have numbers on that. And also, what would you say it says about the way this war is being conducted, that so many people and so many children are suffering such horrific injuries? And sorry, finally, just to follow up on the question earlier about the WHO reform, I was wondering if you could say how many people have been laid off so far, and what when the next layoff announcements are expected. Thank you.
Thank you, Nina. I would like to invite our colleague Pete Skelton, who is joining from Beirut, to take the first question. Pete, you have the floor.
Thank you, colleagues, and thank you very much for the question. I think if I can start actually just by expressing my appreciation to colleagues on the ground and partners who contributed to this report. I think we had 32 different organizations providing services that have provided input into the report, and also to express, I think, a very deep sorrow at the fact that we have rehabilitation colleagues that were injured this morning in Gaza and in a very difficult situation, and one colleague killed as well, not from WHO, but from an external organization. Regarding the question, I think the numbers that we see are really in line with the initial report which we presented. So we've seen the same trajectory followed, and indeed the numbers that we present are very much in line with the initial work that we did in the same period last year, which is that this 25% of all of the injuries are expected to be life-changing. Within that, on the side of the amputations and children, so we have a lot more data now in terms of age disaggregation, and we see very clearly that around a quarter of injuries are in children as well. And what we've seen is that children appear to be disproportionately vulnerable to amputations, and a particularly high number of amputations in children under 5 identified in the report from one particular data set. I should say with the report, and we're very, very clear on this, we draw on a number of different data sets. Broadly, the data is consistent and reinforces the same things that we've been saying throughout, but there are enormous challenges in collecting sort of accurate and up-to-date information in Gaza, and those challenges persist. So we've done the best job that we can in terms of compiling multiple different sources to give the best overall picture of the situation. And I think most of the other details are contained within the report, but I'm happy to add any follow-on. Thank you very much.
Thank you, Pete. Rick, do you have anything to add?
Yeah, maybe I would, thank you very much. I would like to add that for me, and that's not surprising, but it should be shocking for the whole world that we see, as Pete said, we see the same trajectory. So this assessment was done based on from January till May, and now actually from January till July 2025, from January 2024 to July 2025. And it is really shocking to see that you see the same number, like roughly one quarter of patients. The injuries are so serious. I mean, lifelong rehabilitation will be required. The number of children, I mean, Pete have referred to relatively high, including the amputation. We have, I think, consistently reported on. What we didn't report on, and it's definitely in the report, of course, also the mental health trauma, which is actually associated with a lot of the injuries we talk about, and we hardly touch on that. I would like to see it, and that's of course a complete different discussion, and well, also complete different needs. Over to you.
Thanks so much. I would like now to invite Mallory from BBC to ask the next question. Mallory, you have the floor.
Thank you very much. Could you provide an update on the situation of malnutrition in Gaza, specifically among babies and children, and if there's been changes after some more aid has entered the Strip? And in relation to that, if you can comment specifically on supplies and any shortage of baby formula for infants.
Thank you, Mallory. I would like to ask, Rick, do you want to take this question?
I'll try. So just to go back to malnutrition, and I think also say something about WASH. We've seen malnutrition-related deaths, 400 validated, and 101 of these are children, of which 80 are below the 5 years old. The centers, the malnutrition centers, actually, which are currently functioning, is only actually 4. So there's 4 malnutrition centers which are still functional. Of course, Rantisi was also lost. There were and Rantisi that other actually would affect another 132 children. And nutrition response, we continue to face major operational constraints, including the critical shortages of therapeutic foods and which are needed in this therapeutic feeding units like this called F75, F100, and the RUTF, etc. Insufficient space to also expand the some sub-centers within existing facility. Displacement orders from Gaza City also heavily disrupted program implementation and raising actually the default rate among children enrolled in this life-saving nutrition services. So and then actually in the combination, when you talk about it, so another combination on water and sanitation, and 1 million people are accessing less than the emergency minimum of 6 liters of drinking water per day, according to recent assessments by water, sanitation, hygiene partners. So I think coming back, yes, you see a little bit more food on the market. True, prices have dropped a little bit, but are still relatively high. But I think everything what we have seen, and I think all the former reports, of course, have referred to that. It will take time before before malnutrition actually, before you see a different trend on this. Also, the food diversification is still a massive problem. And again, overall, the prices for general population are still way too high. Over to you.
Thanks so much, Dr. Pieperkorn. Teresa?
Thank you very much. I think it's a very, very pertinent question, considering this is also the lives of very, very young people in Gaza that we're suffering, and also at very imminent risk of dying. I think beyond what the numbers are actually saying, as what Dr. Rick has already elaborated on, is we're only seeing the tip of the iceberg when a child actually requires treatment because of complications due to severe acute malnutrition. There are thousands of others who are on their way into that same condition if insufficient humanitarian aid is actually delivered rapidly and by all means possible. And so this is why we keep on calling. It's not about the malnutrition cases and those who end up in treatment centers that we need to focus on. It's also the risk of all of the other children, pregnant lactating women, and the general population of Gaza who continue to suffer from the deficiency, food deficiency, from insufficient access to healthcare and other very, very basic necessities in order to survive. And this is pertinent for Gaza, this is pertinent for West Bank, as well as in all other countries where people are suffering from conflict and natural hazards. Thank you.
Thank you so much. I would like now to invite Priti Patnaik from Geneva Health Files to ask the next question. Priti, you have the floor.
Thank you for taking my question. I was wondering, I had two questions. One was whether WHO can actually comment on, the implementation of the Geneva Convention with respect to Gaza. And the second question is a follow-up on the no confidence vote. I wanted to know what specific measures will be taken to restore faith among staff and member states as a result of this vote, which I understand is not legally binding. Thank you so much.
Okay.
Maybe, Fadela?
Yeah?
Maybe if I just jump in on the no confidence vote and say that this was a vote by the staff association, some members of the staff association in Geneva. There were approximately 200 votes. We have a population of about 3,000 people in Geneva. So I wouldn't necessarily say that it's representative of the population in Geneva, one. And two, I don't think it's a no confidence vote in the DG or the organization itself, the management. It is more around the prioritization process where there are a number of questions that staff are asking, and we're in the process of addressing those questions with the staff. So perhaps I leave it at that. Thank you, Fadela.
Thank you. Yeah.
Thank you. On the first part of the question, I think it's important to highlight that we, as an organization, we contribute to upholding the Geneva Convention. We're present where humanitarian needs are present. We care for those who are wounded, who need health services, and we continue also to monitor the public health risk that these individuals are facing and call for everyone who has influence, member states, parties to conflict, to actually adhere to these conventions and make sure that access to healthcare is secured, that attacks on healthcare is actually ended forever, and that eventually then conflicts could end, because that's the only way that we can actually restore the health of all of those who have been affected by these. Thank you.
Thanks so much. I can see that our legal counsel, Derek Walton, is, maybe he can also answer this question. Derek, you have the floor.
Thank you very much. I hope you're able to hear me well. Excellent. Yes, in terms of the question about the application of the Geneva Conventions to the situation in Gaza, I think it's to point out WHO is a humanitarian and development agency and needs to remain neutral in terms of conflicts. So it's not our role to attribute blame or apportion culpability for attacks under the Geneva Conventions. That said, the Director General has made very clear on a number of occasions in calling on the parties to the conflict in Gaza to abide strictly by humanitarian law and in particular the Geneva Conventions. And it is very clear that under the Geneva Conventions, attacks on healthcare are prohibited and can never be tolerated. And so the Geneva Conventions certainly apply in that context, and parties must continue or must apply rigorously. But as Rick said earlier, when we were talking about attacks on healthcare, our focus is on identifying what has happened rather than on apportioning blame and attributing legal consequences to those actions. Thank you.
Thank you, Derek. I do not see any other hands, so maybe we can close this press conference. Oh, okay. So as many journalists expressed interest in the situation of Ebola, and we have the opportunity to hear from Dr. Janet Diaz, who is just back from DRC. Maybe, Janet, you can say a few words about the situation of Ebola in DRC and our actions there. But we may start first by Dr. Chikwe for the overview, and then we come back to you. Thank you. Dr. Chikwe?
Thanks, Fadela. Yeah, on the outbreak, it's a month now since we started responding to a new Ebola outbreak in the DRC. One of several alerts that comes into our organization across the world every single day, goes through verification processes, and ultimately was confirmed. Really excellent work by our colleagues at the national level, got the sequence for this strain almost within 24 hours. And which then triggered a whole chain of activities. Firstly, in getting to the location, very remote location, together with our UN partners, we set up an air link and started deploying the first staff, both from our teams and the National Public Health Agency in Kinshasa. And that has led to a series of activities. WHO immediately released $2 million from its contingency, from our contingency fund for emergencies that enabled the initial response. And basically things have moved on fairly well since then. We recently, over the last couple of days, launched our strategic response plan that still requires a little bit of resourcing to support the work happening already. This has gone fairly well up to now. We are on the 5th day without a case, but we are by no means out of the woods, so we have to keep pushing on all the various strands of the response. Janet, my colleague, who will speak to you shortly, was one of the very first colleagues that deployed to the field almost immediately, has just returned in rotation. The next team has been deployed. So she will now share a few words on the response, on what WHO has done with our colleagues, our partners, and critically, the capacity that has been built locally in their national Ministry of Health, their national public health agencies in response to the outbreak. So let me ask Janet to just share a few words on the actual response and her experience from the field.
Thanks, Chikwe, and thanks for the opportunity to give a brief update from the field. So I just arrived back a couple of days ago, so excuse me if I'm a little tired. What we found there, as Chikwe has already described, it is a remote area, difficult to get to. Logistics are really hard. So I just want to commend the local workforce and the initial teams that went out there from the National Public Health Institute, as well as the partners that were there with the first teams to pretty much set up the response. So I think the work that has been done in the past 3 weeks has been an incredible feat based on the logistical challenges that we encountered collectively. One of the areas when you are working in such a remote area and when you have logistic challenges and your resources are limited, right, and you're pending on the air bridge or the helicopter to bring you the supplies and things that you need, you have to make good decisions on the ground to make sure you prioritize the right activities that can be done with the resources that you have. And I want to commend the leadership of the incident manager of DRC and how that leadership team, the incident manager with partners, WHO obviously there as well, how we made decisions to do the right activities around the cases. And in the field, what we saw was a real collective work to treat to get around all those confirmed cases, to do, the best contact tracing follow-up that we can do, to make sure the ring vaccination, even to those remote places where you have to go on a motorbike to get to those contacts to vaccinate them, that happens. And that was happening, to get the vaccine supply in there before we had the cold chain set up, so it doesn't, so it's still good and you can still deliver it to patients. So all this type of activities, really well planned and really difficult to execute, but was and is happening now. Getting good infection prevention and control teams to the households of the confirmed cases to ensure decontamination, to stop spread of infection. Again, a very kind of surgical approach to outbreak response that had to be done to be efficient with what we had. In regards to care pathways and treatments, that's my area of work. Specifically, really working within the system, the structures where our initial treatment center, the initial treatment center had been set up was the General Hospital of Bulape. And that is, a resource-limited hospital. It didn't have consistent access to electricity, for example, or consistent access to water. So together, jointly, focusing on the basics, can we get the water system strengthening? Can we get a generator to augment the electrical supply? Can we get the facilities, the circuits in place for good infection prevention and control and biosecurity, starting from the basics as well, and together collectively with the local teams, with our partners, such as, and I do want to acknowledge the partnerships and the collective work that has been happening in the treatment center with to support the Ministry of Health with MSF, with ALIMA, with IMC, even with World Vision and WFP, who's providing nutritional support to those patients in the treatment center, really a collective effort to ensure the best standards of care in place. Currently, we had been working on establishing a new treatment center, so to move the patients from this treatment center that we're using right now within the hospital, and we're using innovations that we've been working on for years with partners, how to deploy faster treatment centers with good visibility so that the monitoring of patients can be done better from the green zone, and that also the community perceptions of the treatment centers are more positive. I want to highlight a few things that we had improved while we were there, that had been going on, that we were working on while we were there. One was also the access to optimized supportive care, again, doing the basics well, and through partnerships and led by the INRB, that they were able to, in addition to have, the rapid diagnostics, the gene experts for the PCR testing, also to have a biochemistry point of care test. And that may seem something simple, but it was actually difficult to get to the field. But with that, and with access to medical oxygen, which was also by concentrators, we were able to really improve the quality of care by getting those very sick patients individualized patient care through correction of electrolytes and those things. And finally, just to acknowledge again all the staff that's working there, the local staff from the hospitals and that area that has been relocated to work within the treatment center, their bravery, their commitment to best caring for those patients, and then with the partners, us all collectively supporting so that those patients can get the best care possible. Maybe, and then final comment on the access to therapeutics, because this always comes up as well. Again, to the strengths of the national team, the INRB, where they did have stockpiled one of the life-saving monoclonal antibodies that was found to be life-saving in a clinical trial that they conducted in 2019. So that was available and has been available to treat confirmed patients and under the close monitoring of the colleagues from the National Institute of Biomedical Research, the INRB. So thanks.
Thank you so much, Dr. Chikwe, Dr. Diaz, for this important update. Now I think it's time to close this press conference. I thank you for your participation. We will be sending the audio file and DG opening remarks right after this press conference. And please don't hesitate to contact the WHO media team if you need any other information. And with that, I would like to hand over to Dr. Tedros for his closing remarks. Dr. Tedros, please.
Yeah, thank you, Fadila. Thank you to all members of the press for joining us today, and see you next time.